I give the education lecture on this topic. Basically, difficult follicular lymphoma patient is no longer as in the past, the absence of treatment. Often is the difficulty is to choose the appropriate treatment in a very broad and therapeutic armamentarium. We have now more treatments. All the treatment lines are changing very rapidly, and this is generating novel issues, novel unmet need, and also generates a lack of knowledge on some issues. So basically, I focus on all the different phases of follicular lymphoma treatment, which could be the difficult points, the choice of treat or not to treat a low tumor burden patient, so the choice of active surveillance versus the choice of rituximab monotherapy. I discussed the first line treatment with all the issues of potential toxicity and immunosuppression versus the risk associated with alternative treatments, the role of maintenance and how maintenance should be delivered. Then I discussed the first relapse with the issue that novel approaches such as TAFR2 and EPCAR2 are now basically wiping out the line from older treatments such as autologous transplantation, and of course they provide a better solution compared to the HER2 standard for a large proportion of patients, especially high risk. I then discussed the third line, comparing CAR-T versus bispecific, and also discussed the issue of patients that fail either CAR-T or bispecific. How should we handle them? How should we treat it in a context where the available treatment are indeed many, but we don't have accumulated enough knowledge specific of follicular lymphoma for how to choose, how to define the strategy if you use first bispecific, first CAR-T or whatever, and also the potential use of new treatments coming into this field. Finally, I touched upon the issue of elderly frail patients that are again a population that is still not very well studied for follicular lymphoma, that has a specific critical issue that need to be addressed. But considering that this patient can also achieve excellent responses if you can provide an approach which is adequately safe and effective, and also they should also be considered with an optimistic view approach and an optimistic view for as they can obtain very brilliant responses in many cases.